Hello, good morning, good afternoon, good evening, whatever time it is that you are watching this. Thank you for watching. So, what are you drinking today? I am drinking Stephen Smith Meadow with organic local honey and organic stevia. Ooh, they came out with one called Apple Meadow that I really would love to try. Um, it, I think they like aged it in it's apple brandy meadow, and they aged it in apple brandy barrels or something for like 2 years, something like that. But I would really love to try that. Anyways, what'd you do this week? Anything interesting? Oh, by the way, if anything happens during this feed, I'm having a case of the Mondays, so just bear with me. Um, I really like how a lot of first thing Monday morning, everything tends to fall apart. So yes, I'm having a case of the Monday. So if something happens, bear with me, please. And speaking of which, too, I know there's some kind of feedback going on. We got a new mic a couple of weeks ago when we changed positions. There's a new mic that are using. The mic I had before this would block out or somewhat block out background noise. I know this one's very sensitive, so we're working on trying to get that fixed. So bear with us, please. I'm familiar with it, just bear with me. Anyways, so yes, I still have my Teal Butterflies up. I'll have those up through September. So September is full of awareness for a lot of different things. I think I need to correct myself. Last week I said pancreatic cancer, I believe. It's not pancreatic cancer. That is in November with lung cancer. It's prostate cancer. So prostate cancer, September is also Prostate Cancer Awareness Month, Thyroid Cancer Awareness Month, and then you have Gynecological Cancer Awareness Month, which consists of ovarian with teal butterflies. Have you taken your teal butterfly challenge yet? Um, Cervical, uteral, endometrial, vaginal, and vulvar. So all of those fall under gynecological cancer awareness, and this is September is cancer or awareness for those cancers. There's also awareness month for blood cancer, so for like leukemia, lymphoma, and myeloma. Um, Actually, one of Sean's coworkers years ago, her husband had gotten multiple myeloma like in his 30s, which is very rare. Um, but he's doing very well now. So he's doing well. So, but it was just really interesting. So yes, and it's also Childhood Cancer Awareness Month. I mean, it's a struggle to definitely deal with this as an adult, but a child to have to grow up so quickly just to deal with something like this is can't imagine. Another one of Sean's colleagues, their their toddler had gotten he has leukemia, if I remember. I think leukemia as well. She's doing well. She is in remission too. So I think she just turned 3 or 4. But yeah, just watching her go through that was like I said, it's a lot for seeing adults and someone you care about to go through, but like a child who's so innocent to go through it is yeah. But they're so amazing when they do. Like they sometimes I feel like they handle it better than adults do. So sometimes you can definitely learn a lot from them. But yeah, but so and as we talk about awareness, this is going to lead us into bringing awareness to our bodies and our journey. So we'll first talk about um, the benefits, and they're the same, and then we'll talk about the difference between yoga and Tai Chi. Now, the benefits, the physical benefits, are reduces fatigue. Studies show that it can significantly reduce fatigue levels during and after your cancer treatment. It also improves sleep quality and reduces sleep disturbance. It also alleviates pain. So, when you alleviate pain, that means less pain medicine that you have to put into your body or into your system. Also, again, when you're in pain, your system's working on that and fighting that pain, whether it's your muscles or anything, and it causes you to tense. You're not getting rest. Your immune system's still not doing what it should be doing. So it also enhances physical function. So it both can improve muscle strength, balance, flexibility, physical stamina, which may be reduced by treatment. And this can also reduce the risk of falls, especially in older patients. Because if you're going the route of infusion and radiation, they can wear on those parts of your bodies, whether it's your muscles, your bones, your nerve endings. It can wear on those, and in turn, it weakens your overall body or your overall strength. It weakens you, and even like after the fact, you this is something I would definitely recommend if you can do during like before, during, and after. Definitely something I would try to integrate into your day. Definitely do, or your schedule. Definitely do that, because even after everything's all said and done, you're in remission. Your body never fully goes back to the strength, the energy it does when you don't integrate something like this from the infusion and radiation. I know this for a fact. I've seen it. My mother. So I'm saying this from experience, not from reading anything. It also helps boost your immune function. So studies suggest both can positively impact the immune system, decreasing inflammation and stress hormone levels. So again, your immune system helps fight off the disease. The infusion weakens your immune system, but the infusion's also fighting the disease as well. So anything else to help add that boost to your immune system is always good. And of course, if you're stressing, like I always say, stress is one of your worst enemies. Stress can cause you a lot of physical issues with your body. You can cause, ulcers could be caused by stress. We talked about muscle knots. Different things. Like stress can cause you to have a kidney stone. Like it can trigger things in your body to do these things, to create things that are harmful to you. So again, anything to lower those stress or to decrease your stress and build up your immune system, the better, right? So yoga and Tai Chi can also support mental and emotional health. It reduces stress and anxiety, like I just said. So a combination of gentle movement and mindfulness helps calm the nervous system, reducing anxiety, stress, and overall distress. So again, it builds up. It does not do you any good. It also helps combat depression. It helps increase mindfulness. So connection between the body and mind provides a sense of control. Again, like I was saying last video when we were talking about massage therapy, no matter how connected you are with your body before your diagnosis, there's still a small part of you that is going to feel like your body betrayed you. In the docuseries that I talk about towards the beginning of the videos, when we start talking about resources, Hill, there was a lady in there, like she ate organically, she exercised, like very healthy, but was so surprised when she got the cancer diagnosis because she did everything right. And she thought that, she was connected to her body, and then there's a part of her that felt betrayed by her body. So that reconnecting or, connecting with your body is always good. And then it always, you feel like you don't have control because you're at, to some degree, depending on what path you take, you're at the doctor's mercy or your team of doctors' mercy, and when they're able to get you in and scheduling appointments and all that for if you decide to go down that path. So by doing these things, adding these alternative therapies in with what you're doing, it helps you feel like you're doing something for yourself in the meantime while you're waiting on them. So classes can also foster, like if you decide to do a yoga class or a Tai Chi class, they can foster a community. So sometimes it's nice being around other people, just in general. 1, 2, being around other people that have something in common with you. So practicing yoga or practicing Tai Chi. So kind of the same thing with like book clubs and different things like that. But also too, another thing, and kind of the whole reason that I even started this organization originally was for you to be around other people who have gone through what you've went through, or so they can understand what you're going through because they've been there. So same thing with the caretakers. So either they've been through it themselves or they've, their loved one has been through it. So that was kind of the whole idea. So you didn't feel alone and like nobody knows what you're going, nobody understands what you're going through. So what are the difference between the two? So the origins, you have yoga, which was originated in India as a spiritual practice with roots in ancient Hinduism. Then you have Tai Chi, which was developed in China as a martial arts form. But Tai Chi is not, it is as a martial arts form, but it's not strenuous as if you were going to take a martial arts class. So movement, yoga emphasizes static postures that are held for extended periods. Tai Chi focuses on slow flowing and graceful movements that resemble a dance. So Tai Chi, you're always moving. Yoga, you're holding a pose and doing and focusing on your breath or your breathing. Focuses. Yoga aims to unite the body, mind, and spirit through postures, breathing, exercises, and meditation. Because remember, when you're focusing on your breathing, That's also a form of meditation. Tai Chi primarily focuses on balance, coordination, and improving internal energy flow. Now, here's the thing. Both of those do the opposite as well. So, like yoga also works on balance, coordination, and improving internal energy flow, but that's not the main focus. Tai Chi also works on your body, mind, and spirit, or through breathing, more so exercise and meditation. They don't have postures because you're free flowing, or I shouldn't say they do have postures, but it's not, you don't hold the posture, like you continue to move. So, but that's not the main focus. So you get all of that with both of them, but either or focuses on the other. Now, how do you decide which one you want to do? I would say if you hadn't tried either one of them, try it to see which one you like. Now, my husband doesn't like yoga. To him, it's boring. I get it. I love yoga, but I also have to be in that state of mind to, okay, I'm going to do yoga. Yoga also, there's different practices of yoga. So a lot of people really dive deep into practicing yoga, what the practice is, and meaning behind it, and everything. Whereas, and I haven't gone that far. I just go on. Honestly, I go online and find like something that fits for what I'm needing in that moment. Type of yoga practice that I'm needing for that moment. Now, Tai Chi, I think my husband hadn't. I think he tried it once, but I'm trying to get him to get back into it again or try it again because it's a constant movement. So I feel like if you think yoga would be too boring or you don't want to, you didn't like it, try Tai Chi. Again, it's different. It's constant moving, constant flowing. I do like Tai Chi. Is something I would like to get back into more than I have recently. So yes. But anyways, how do you get started, right? So we're talking about how do you choose someone? How do we get started? So you always want to consult with your oncology team. Okay. Sweetie. Make sure always consult with your oncology team. Make sure it doesn't interfere with what they have, your journey they have for you, with your treatment. I can't think of the word treatment again. Like I said, I'm having case on Mondays. Make sure it doesn't interfere with your treatment. Again, you remember, your oncologist knows more about, well, I should say no. A lot of times your oncologist knows more about the infusion. They use these for a reason. They've seen pros and cons a lot of times, things that worked and haven't worked, or any issues that may have come up with different people, different cases that they've had. Not always, but I'm just saying a lot of times that is the case. And so consult with them to make sure that what you're wanting to do isn't going to interfere with the treatment, or the medicine or the infusion you're getting isn't going to cause any issues if you were to do something. Or it could be, oh yeah, make sure you can do this, but just as long as you don't do this, or something specific. So definitely consult with your oncology team. Again, seek out certified instructor with specific experience working with cancer patients. I cannot harp on this enough, whether you're going the route of Western medicine or whether you're going the route of Eastern medicine, or, completely alternative medicine, like if you're not doing infusion or anything, always make sure you work with someone with experience with working with cancer patients. Mainly for your safety. Okay. Practices can be tailored to your needs and limitations. One of the main things, I would even say with both of them, but I guess mainly with yoga, depending on what you're doing, is like the key is not to hurt. Like, don't push you go as far as you can. If you start feeling pain, then you stop. If you start feeling, if it feels a little uncomfortable, then you stop. You go as far as you can. So that's why, like, both practices can definitely be tailored to your needs and limitations. And it's also, even though just about every yoga instructor I have ever seen has always given even alternative if you're not able to do the full move. But if someone's used to working with cancer patients and you have a specific limitation, they have a quick response or know how to work around that. So another thing to keep in mind. You have also definitely hospitals, cancer centers, and some community centers who started doing this. Even community centers for cancer patients. Sometimes, like your smaller towns or something that may not have a cancer center, you may look up and have someone who's used to working with cancer patients and decide to bring that into the community or community center. And then, of course, cancer centers, hospitals, like I said, a lot of these things are starting to become more popular. And so you also have local cancer charities that may do it as well. So when I say that, so like Teal Butterfly is a local cancer charity for their city of Charlotte. They do in surrounding cities. They're not really a national group, though they are somewhat known nationally. But then you have your national chapters, but some of your smaller organizations, nonprofit organizations, sometimes specific to your cancer specific to your type of cancer may do something like this. It's definitely something I would love to build this platform up to at some point be able to have someone that can post videos to be able to do this as well. That would be nice. But you can also find it online. There are online videos, yes, specific to cancer. To kind of get you started, I did post two videos in the descriptions, or links to two videos in the description, one to yoga, one to Tai Chi. And then, of course, when you go into them, they also, other request of videos similar to that online, so you can find those online. Sometimes I don't know if Amazon has it to where it's specific to cancer. I haven't seen any, but I also know they have their new Gaiam, I think that's how you pronounce that brand. They have that new channel now that you can pay for that has a lot of different things. And yes, that it can get really, really new agey in that channel as well. But I say in a sense, I don't know if they have anything specific to cancer in that. But you can also look to, like, you can see what they have before you, like, purchase the channel too. But yeah, but definitely redo it. Start slowly. Begin with short sessions and gradually increase the duration and frequency as your strength and energy allows. So you're going to, if you're taking infusion, you're gonna be tired. You're not gonna have as much energy. Same thing, even if you do have cancer, it does like suck your energy in general, whether you're taking infusion or not. But so probably if you do like a session and it's a short session, you might be tired after that, and that's fine. There's nothing wrong with that. So what you do is you start with that short session and keep doing it. If it's one of the ones you like, keep doing that session, and then if you feel like, then if you're not as tired after it, so then do it like 2 days instead of 1 day a week. Do it 2 days a week, and then kind of build that way. Or add, or if you find another longer session, whether it's 5 minutes longer, 2 to 5 minutes longer than what you're doing, try that and see how it works until you're starting to get, okay, I can do this, and you can integrate in how much you want to and however long you want to, and it helps build you up. Even like, and I say that too because even right now, like for a good yoga session, like I hadn't done it in a while, and where we're at, one of the people around here had decided to do yoga because she was learning how to teach yoga, and she decided to do yoga for the people around the area. And I went to a couple of her classes, and it was like an hour-long session. Like, it was really nice, but it also, like, it really tired me out too. So after the fact, because it'd been a while since I had done it. So yes. So yeah, definitely leave it in the comments if you do yoga or if you do yoga through cancer, or like for cancer patients. Let us know what you do. If you use someone specific, so whether they're in their town or even if it's online video. If it's an online video, definitely let us know who it is or what it is. Or I don't know if you're able to put the link in or whatnot, do add the link to the chat so people can experience it as well. So yeah, definitely do that. And I know last week I said something about a skincare product. I think I'm going to do a separate video and post later this week about this specific skincare product for radiation. So I'll do that. So definitely be on the lookout for that. And yeah, thank you for watching and have a wonderful day. Have a wonderful week. And we will see you next week under the willow tree.